Have you ever woken up in the middle of the night, wide awake and unable to drift back to sleep? Or maybe you've found yourself tossing and turning for hours, feeling frustrated because sleep seems so elusive, even though you're exhausted. If this sounds familiar, you're not alone. For many older adults, sleep becomes a challenge as we age. It's one of those things that's easy to take for granted until suddenly it's no longer as simple as it once was. In this video, we're going to dive into a topic that affects so many of us: why older adults often struggle to sleep through the night and what you can do about it. As we age, our bodies go through a variety of changes, and some of those changes can interfere with our ability to get a full night's rest. But don't worry, there are practical, actionable steps you can take to improve your sleep and wake up feeling refreshed. So, let's take a closer look at the 7 common reasons older adults struggle to sleep through the night and explore some tips that can help you reclaim your rest. The first reason many seniors find it hard to sleep through the night is something called sleep fragmentation. This is when your sleep is interrupted multiple times during the night, preventing you from reaching the deep, restorative stages of sleep. Sleep fragmentation can happen for a variety of reasons, but one of the most common culprits is the natural changes in our sleep cycle that come with age. As we get older, we tend to spend less time in the deeper stages of sleep, like the slow wave and REM sleep stages, and more time in lighter sleep. This means that even if you're asleep for a full 8 hours, it might not feel as restful because your sleep is more easily disrupted. You may wake up more frequently throughout the night, whether it's because you need to go to the bathroom, your mind is racing with thoughts, or simply because you've reached the lighter stages of sleep. It can be frustrating because it feels like you're getting enough sleep, but you're still waking up tired. A great example of this comes from a woman named Mia, who's 72 years old. Mia has been struggling with sleep fragmentation for a while. She would fall asleep just fine, but then she'd wake up around 2 or 3 a.m. and have trouble falling back asleep. After speaking with her doctor, Mia learned that sleep fragmentation is a normal part of aging, but there are things she can do to manage it. For her, creating a more consistent bedtime routine and avoiding caffeine in the afternoon helped her avoid those frustrating middle-of-the-night wake-ups. Mia still wakes up occasionally, but with these small changes, she's able to fall back asleep much more easily and feels more rested overall. The second common reason older adults struggle with sleep is pain. Whether it's arthritis, back pain, or other chronic conditions, pain can make it hard to get comfortable enough to fall asleep or stay asleep. The discomfort can become especially noticeable at night when there are fewer distractions and you're trying to relax. Pain can also interrupt your sleep if it becomes more intense during the night, or if you have to get up to adjust positions or take medication. For example, take Frank, a 68-year-old retiree who has been living with osteoarthritis for years. Frank found that as the years went by, his joint pain would become worse at night, often waking him up. But after working with his healthcare provider to develop a better pain management plan, he found relief. Frank was prescribed a low-dose medication at night and started using heat therapy before bed, which helped loosen up his joints. He also started incorporating stretching exercises into his daily routine to help keep his joints more flexible. These changes made a huge difference, and Frank now sleeps much more soundly. It's important to remember that if you're dealing with chronic pain, it's always a good idea to talk to your doctor. They can help you come up with a plan that works best for you, which may include medications, physical therapy, or lifestyle changes. The third reason many seniors struggle with sleep is sleep apnea, a condition that's more common in older adults than we might realize. Sleep apnea occurs when your airway becomes partially or completely blocked while you're sleeping, causing you to stop breathing for short periods of time. These interruptions in your breathing can cause you to wake up multiple times throughout the night. leaving you feeling exhausted in the morning. Often, people with sleep apnea don't even realize they're waking up during the night. If you're dealing with frequent snoring, waking up gasping for air, or feeling tired no matter how much sleep you get, it might be worth discussing sleep apnea with your doctor. A sleep study can help determine if sleep apnea is the root cause of your sleep disruptions. Now that we've covered the first three reasons, sleep fragmentation, pain, and sleep apnea, it's clear that there are several factors at play when it comes to sleepless nights. But don't worry. These challenges are all manageable with the right steps, and there's more we can do to improve our sleep. Stay tuned, because in the next part, we'll dive into the other reasons that might be affecting your sleep and offer more solutions that can make a real difference. One of the next big contributors to sleepless nights is medications. Many older adults take medications for various health conditions, and while these medications can do wonders for our health, they can also have side effects that affect sleep. Some medications, particularly those for blood pressure, heart conditions, allergies, or even depression and anxiety, can disrupt the natural sleep cycle. This can make it harder to fall asleep, stay asleep, or feel rested even after a full night of sleep. For example, take Barbara, a 70-year-old woman who was taking medication for high blood pressure and depression. She noticed that she was waking up multiple times during the night and feeling groggy the next day. After discussing her sleep issues with her doctor, Barbara learned that her blood pressure medication was causing her some restlessness at night. Her doctor adjusted her medication, and Barbara also started taking a lower dose of a sleep aid that was safe for her. The result? Barbara was able to sleep through the night more consistently and felt much more energized the next morning. If you're taking medications and struggling with sleep, it might be worth having a conversation with your doctor. They can evaluate your prescriptions and may be able to make adjustments or suggest alternatives to help improve your sleep without compromising your health. The next factor that can cause sleep disturbances is anxiety or stress. It's natural to feel anxious from time to time, especially as we get older and face different life changes such as retirement, loss of loved ones, or health concerns. However, chronic anxiety or stress can make it incredibly difficult to wind down at night. When your mind is racing with worries, it can be nearly impossible to relax enough to fall asleep. Even if you manage to drift off, anxiety can cause you to wake up in the middle of the night, feeling restless and uneasy. For those who struggle with anxiety or stress, mindfulness practices, journaling, or relaxation exercises before bed can be incredibly helpful. Sometimes, simply giving your mind permission to let go for the night can make all the difference. Before we move on to the next point, I want to take a moment to express our appreciation for your time. If this video is helpful, please consider subscribing. Your support allows us to keep creating great content. Another factor that many older adults don't realize is how important light exposure is when it comes to regulating your sleep-wake cycle. As we age, our body's internal clocks, also known as circadian rhythms, can become less sensitive to light. This can make it harder to fall asleep at night and wake up in the morning feeling refreshed. Exposure to natural light during the day helps regulate these rhythms and promotes a healthy sleep cycle. Take the case of Linda, a 73-year-old woman who was having trouble falling asleep every night. After consulting with her doctor, Linda learned that she was spending most of her day indoors, away from natural light, and only going outside for short periods. Her doctor recommended that she try to get more exposure to sunlight during the day, even if it was just sitting by a window or taking a short walk outside. Linda made a conscious effort to spend more time outdoors, and as a result, she noticed that her sleep improved. She was falling asleep more easily and waking up feeling more energized, thanks to the sunlight's natural effect on her circadian rhythm. If you find yourself spending a lot of time indoors, Try to incorporate more outdoor time into your day. Even a short walk outside in the morning or afternoon can help reset your body's internal clock and improve your sleep at night. Now that we've talked about medications, anxiety, and light exposure, it's important to address the impact of caffeine and alcohol on sleep. While a cup of coffee or a glass of wine might seem like a good way to unwind, both caffeine and alcohol can interfere with the quality of your sleep. Caffeine is a stimulant that can keep you awake, and alcohol, while it might initially help you fall asleep, disrupts your sleep cycle and can lead to more frequent waking during the night. Take the story of Ed, a 69-year-old man who enjoyed his nightly cup of coffee and glass of wine. He didn't think it affected his sleep, but over time, he started noticing that he was waking up multiple times during the night, feeling restless. After discussing his habits with his doctor, Ed learned that both caffeine and alcohol could be the culprits. He decided to cut back on both, avoiding them later in the afternoon and evening, and he quickly noticed an improvement in his sleep. He was falling asleep more easily and waking up feeling less groggy. If you're struggling with sleep, try to avoid caffeine after 2 or 3 p.m. and limit alcohol consumption before bed. You might be surprised at how much of a difference these small changes can make. Now that we've discussed some common reasons older adults struggle to sleep through the night, let's move on to a few additional factors that may be affecting your rest. At this stage of life, sleep disruptions aren't always just about the mind or the environment. They can also be deeply connected to physical changes in the body. Understanding these changes can help you tackle sleep issues head-on and improve your nightly rest. One important factor to consider is physical discomfort or pain. As we age, it's common to experience conditions like arthritis, joint pain, or back problems that can make it difficult to find a comfortable sleeping position. Chronic pain can disturb your sleep, either by making it hard to fall asleep in the first place or by waking you up during the night. But there's good news. There are steps you can take to manage this discomfort and improve your sleep. Another factor to consider is sleep disorders, such as sleep apnea. Sleep apnea occurs when your breathing repeatedly stops and starts during sleep, often causing you to wake up abruptly and feel fatigued in the morning. This condition is more common in older adults, especially those who are overweight or have other health conditions like high blood pressure or diabetes. Sleep apnea can significantly impact the quality of your rest, leaving you feeling groggy, irritable, and unable to fully recharge at night. For example, take Linda, a 70-year-old woman who always thought her restless nights were simply a result of aging. She often woke up gasping for air and felt tired during the day, even after what seemed like a full night's sleep. When Linda mentioned this to her doctor, she was referred for a sleep study, which revealed that she had sleep apnea. With the help of a CPAP machine, Linda was able to sleep more deeply and wake up feeling refreshed. If you suspect that you might have sleep apnea, it's important to consult with your doctor. They can perform a sleep study to determine if you're experiencing interruptions in your breathing at night. Treatment options, such as CPAP machines or lifestyle changes, can drastically improve your quality of sleep. Lastly, let's talk about bedtime routines and habits. As we age, our bodies may not be as resilient to disruptions in our daily routines, and having a consistent nighttime ritual can be key to improving sleep. This includes setting a regular bedtime, avoiding stimulating activities before sleep, and creating a calming environment. Establishing a calming bedtime routine can help signal to your body that it's time to wind down for the night. Consider activities like reading, listening to soothing music, or practicing relaxation techniques like gentle breathing exercises or progressive muscle relaxation. The goal is to create a ritual that helps your mind and body prepare for restful sleep. Now, before we wrap up, Let's briefly touch on a final yet critical point: overall lifestyle. What we do during the day has a profound impact on our sleep at night. If you're sedentary during the day, it can be harder for your body to naturally wind down in the evening. On the other hand, staying active and engaging in physical activity can help you sleep more soundly. Even a short walk or a little light stretching during the day can make a huge difference. Consider the story of Sarah, a 68-year-old woman who found herself struggling to sleep for months. After speaking to her doctor, Sarah was encouraged to become more active during the day. She started taking short walks around her neighborhood every morning, and in the evening, she did gentle yoga stretches to relax. It didn't take long before Sarah noticed that she was falling asleep more easily and staying asleep longer. Physical activity, even if it's light and moderate, is one of the most effective ways to improve your sleep. It's not about running marathons or pushing yourself to extremes. It's about finding a balance that works for you and making it a consistent part of your routine. In conclusion, the reasons why older adults struggle to sleep through the night are varied, but they are certainly not insurmountable. From physical pain and sleep disorders to lifestyle habits and medications, understanding what's at the root of your sleep struggles is the first step toward finding a solution. By taking small, manageable steps to address these issues, whether it's adjusting your bedtime routine, seeking treatment for pain, or incorporating relaxation techniques, you can reclaim the restful nights you deserve. Remember, you don't have to struggle alone. Talk to your doctor about any sleep difficulties you're experiencing. Whether it's evaluating medications, considering a sleep study, or recommending specific strategies, they can help guide you towards solutions that work for you. I hope these tips have been helpful, and I encourage you to try implementing some of them in your routine. Everyone deserves a good night's sleep, no matter their age, and with the right knowledge and support, you can get the rest you need to live your life to the fullest. As always, if you've had any personal experiences or insights on improving sleep, I'd love to hear them in the comments. Please share them below. And if you found this video helpful, don't forget to give it a thumbs up and subscribe for more tips and advice on living your best life in your later years. Sleep well and take care.